Good morning. Welcome to the Institute for Work and Health speaker series. My name is Monique Gignac. I'm the scientific director and a senior scientist at the Institute, and I'm delighted to have today with us Dr. Nancy Carnide as our speaker. Before I introduce her and tell you a little bit more about her, I just want to run through a couple of housekeeping notes with you. So if you would like to use the closed captioning, you'll find that at the bottom of your screen. You can turn it on and off under the More button. We hope that you will ask questions or give us your comments. And to do that, we ask that you use the question and answer box at the bottom of your screen. And I will then read the questions out to Nancy at the end of the talk. We often get quite a few questions and comments, which is really terrific. We want to encourage that. What I'll do is we'll try to get through as many as we can this morning. And otherwise, feel free to please contact our speaker and interact with her directly to get your questions answered. If I get similar questions, I sometimes try to bundle them so that we'll ask similar questions at the same time. I apologize if I don't get to your question, but again, please do reach out to the speaker. The recording and the slides will be made available, so you will be able to get access to them. They're often available in about a week. So if you would like access to them, please do check at that point in time. All right, I think we'll get started. Again, delighted to have Dr. Nancy Carnide here with us. She's a scientist at the Institute for Work and Health who conducts research at the intersection between occupational health and safety and substance use. Her program of research includes examining the use and non-medical use of prescription and recreational drugs among workers, their risk factors, and the workplace consequences of their use with a focus on cannabis and opioids. And today, Nancy's going to talk about using cannabis to manage symptoms of work-related injuries, experiences of injured workers in Ontario. Over to you, Nancy.
Thanks, Monique. So good morning, everyone, and thank you for attending this presentation today. As Monique mentioned, I'm going to be sharing some findings from qualitative work that we've been doing on injured workers' experiences with using cannabis for their work-related injuries. So first, I'd just like to acknowledge the research team, particularly Stephanie Premji, who has been working closely with me on this qualitative work, and Sabrina Hossein, our research associate, who has been instrumental in conducting interviews and analyzing the data. I'd also like to acknowledge our advisory committee who provided input at earlier stages of this research. And finally, the study was made possible with funding from the Canadian Institutes of Health Research. So today we're talking about cannabis. And as I think many of us know, cannabis is a unique drug in that it can be used for both non-medical or recreational purposes. But it also has medical or therapeutic effects, which we're still learning about. So estimates in Canada suggest that in recent years, roughly 10 to 12% of adults have used cannabis for medical purposes in the previous year. Now, in the context of work injuries, we know that injured workers can experience a number of different symptoms that also coincide with many of the self-reported reasons for using cannabis therapeutically. We also know from anecdotal and media reports that at least some injured workers are using cannabis for their injuries. And you can see some of the headlines here. And in line with this, several workers' compensation organizations in Canada, including in Ontario, have now formalized policies that outline the conditions in which they will consider reimbursing the costs of cannabis used in the treatment of a work-related injury or illness. And yet, very little research has actually been conducted to understand injured workers' experiences with using cannabis for their injuries. So we did begin some research in this area, and we published a paper where we conducted survey interviews of workers in Ontario with accepted lost time workers' compensation claims for work-related physical injuries and illnesses. And these surveys were conducted approximately 18 to 36 months after the original workers' compensation claim. And what we found was that about 14% of workers had used cannabis to treat the symptoms of their work-related conditions. When we compared these workers to workers who either were using cannabis for other reasons or were not using cannabis at all, what we found was that workers using cannabis for their injuries and illnesses were more likely to report poorer health outcomes, such as more pain, more difficulties with sleep, and poorer mental health. And they were also more likely to not be working. Of note, we also found that most of these workers were using cannabis without guidance from their healthcare provider. So while this was a good starting point to begin to understand how injured workers are using cannabis, we thought this would also be an opportunity to follow back up with these workers and go more in depth into their experiences with using cannabis. So we conducted a qualitative study with a sample of workers who participated in that original survey study, with the general goal of better understanding workers' experiences with using cannabis for their work-related injuries. The scope of the interviews was actually quite broad, and we delved into a number of different areas. But for today's presentation, I'm going to focus on three specific areas. The first is how workers decide to use cannabis. The second is their perceptions of the impact of use. And the third, how they navigate cannabis use in relation to work. So as I mentioned, workers who reported using cannabis to treat the symptoms of their work-related injuries in the previous survey study were contacted again to participate in a follow-up qualitative interview. And this was approximately 4 to 5 years after the original injury took place. We conducted 45 in-depth, semi-structured interviews that lasted anywhere from 60 to 90 minutes. And interviews took place over telephone and Zoom, depending on the worker's preference, and they were recorded and transcribed. We then analyzed the information from the interview transcripts using a thematic analysis approach to identify patterns across the data. In terms of our sample, we had a good split between males and females, and workers ranged in age from 25 to 68 years old. As you can see on the right-hand side, over half of the sample of workers had had sprain, strain, and tear types of work injuries, and the remaining had a mix of other types of physical injuries. At the time of the original injury, about half of the workers in our sample were in trades, transport, and equipment operating occupations. And you can see here the list of their specific occupational titles, including welders, material handlers, and truck drivers. Amongst the other half of the sample, we had a good mix of workers from various other occupational groups, primarily health-related occupations, sales and service occupations, manufacturing and utilities, and education, law, and social, community, and government service occupations. At the time of the interview, 40% of workers were not working, most of which were not working due to their original injuries. Of the 60% who were working, half were still working in the same job that they had been working in at the time of their original injuries. Also, at the time of interview, 3/4 of our sample were still using cannabis to treat the symptoms of their original work-related injuries, and the remainder had discontinued use for their injury, although in some cases they were still using cannabis for other reasons. So I'm going to start first with the findings related to workers' decisions to use cannabis. So there were three main themes that emerged from the data: the recovery context after work injury, cannabis as a pragmatic option, and a cautious choice for some. And so I'm going to explain each of these in a little bit more detail now. So this first theme pertains to the recovery context after injury. What we found is that injured workers who had used cannabis for their injuries often had prolonged and complex recovery trajectories. In fact, many workers at the time of interview continued to experience symptoms from their original injuries, which took place 4 to 5 years ago. These symptoms varied from worker to worker in terms of their intensity as well as their frequency. A common thread amongst this group of workers were the challenges that they experienced after injury. Many had different types of surgeries to deal with their injuries, sometimes multiple surgeries, and they often spoke about experiencing a long delay in which they were struggling to manage their symptoms while waiting to get the surgeries that they needed. Many workers also spoke to dealing with the effects of multiple injuries. So for some, the injury claim that we reached out to them about was just another injury in a long line of either past or recent injuries that only served to compound their symptoms. Some workers also described their recovery as being shaped in part by challenging workplace and compensation system dynamics during the return to work process. So this included pressures to return to work despite ongoing symptoms, limited employer support, difficult interactions with workers' compensation, and either absent or inadequate return to work accommodations that were short-lived, poorly matched to their needs, or inconsistently implemented. And it was in this context that many workers spoke to how all of these conditions further aggravated their injuries. So here's a quote on the left-hand side from Tina. All of the names that we provide are pseudonyms. And she speaks to some of her struggles leading up to eventually having surgery. So I was fighting constantly for the fact that there was more to the ankle. Nobody was listening. I never got any type of pain meds until after my surgery. I was just using Tylenol and Advil like it was my job. Theo also spoke to some of these return to work challenges that he experienced. They said, "We're going to give you light work," but the light work never came. I didn't want to lose my job, and whatever he was telling me, I was able to do it, but with consequences later for my injury. This second theme around decisions to use speaks to how cannabis often became a pragmatic option for treatment for these workers when other approaches fell short. So the timing with which workers began using cannabis varied. So some tried cannabis relatively soon after injury, while others came to it months or even years later. But what was consistent was that cannabis was rarely a first-line therapeutic strategy. Most workers described trying other treatments first. This included various types of over-the-counter and prescribed medications, as well as physical modalities such as physiotherapy, massage, and chiropractic care. But many workers ran into challenges with these treatments. They spoke to these treatments being ineffective or being of limited effectiveness, side effects of medications that were hard to tolerate, concerns about taking in too many pharmaceutical chemicals with all the medications that they were taking, and fears of becoming addicted to medications that were being given, namely opioids. Access and affordability also mattered, especially for the physical modalities. So for some workers, it was simply too expensive to keep up with these treatments, particularly when they had no benefit coverage. But they still needed to find something to help them. So for some workers, cannabis became a consideration simply from prior experience with using cannabis and knowing the therapeutic effects it could have. For many, workers often considered using cannabis after discussions with others. So occasionally, healthcare providers, but mostly friends, family, and colleagues, many of whom had used cannabis before, found it to be helpful and recommended that workers try it. Add to that for some workers, return to work challenges also amplified the need to find something, anything that could help them cope. So for many, cannabis wasn't framed necessarily as an ideal solution as much as a pragmatic one, a why not option when other paths had become limited and it felt like there was little to lose in trying. So Michael here speaks to how he chose to use cannabis due to his concerns about using opioids. I spent time in trade school. I've seen where opioids can lead, and it was all because somebody had an accident and took the prescription, and then they got hooked on it, and then they were buying it on the street, and then it just snowballed, and I don't want to put myself in that position. Joshua speaks to how he felt compelled to try something to help him in the face of return to work. My employers pushed me to come back a bit sooner. I was like, all right, I've got to find something. This last theme in decisions to use speaks to the concerns that some workers experienced in choosing to use cannabis as a therapeutic measure. So not all workers had concerns, and that usually reflected some degree of familiarity with cannabis. They either had prior experience with it or they felt well informed and trusted the sources that were guiding them. So for these workers, cannabis didn't feel like a risky option. For others, though, the decision came with varying degrees of hesitation. So the most common concerns that we heard included worries about ongoing intoxication. So this feeling of not wanting to be high all the time, and the potential impact on motivation. So again, this notion of becoming lazy if they used cannabis. Workers also spoke about concerns over losing control of their use and becoming addicted to cannabis. And finally, there were concerns about the stigma of use and not wanting cannabis to change how others viewed them. So Catherine here speaks to her concerns about addiction and intoxication. I just don't want to be high all the time. I don't want to get to the point where I'm abusing marijuana. I have a sister who is always high and always using it, and I didn't want to hit that level ever. So now we can move on to the impacts of cannabis use. Here, there were three themes that emerged from the data. So the perceived benefits for symptoms and functioning, the more of a helping hand theme, and unwanted effects and limited benefit for some. So I'll move on and go into more detail for each of these. So this first theme speaks to how most workers experienced at least some degree of benefit from using cannabis for their injuries. So the primary effects that workers described were quite symptom focused: pain relief, better sleep, reduced muscle tension or spasms, and for some, reduced anxiety and stress. When workers spoke about the impact of cannabis in the context of work or return to work, the perceived benefits were usually indirect. So they weren't necessarily saying that cannabis changed work status on its own, but rather that symptom improvement helped them to get through the day and meet the daily demands of their job. So in particular, the impacts on pain and sleep together came up often. So not just as outcomes on their own, but often in terms of how cannabis helped reduce pain and helped workers relax such that they could have a better night's sleep, which made it easier for them to function the next day at work and cope with any residual pain. Some workers also described how their cannabis use had benefits on other care. So for a subset, cannabis reduced reliance on other medications or treatments, and others said it enabled engagement in physical modalities, so making it easier to do stretches, tolerate physiotherapy, or participate in rehab activities because symptoms were more manageable. And finally, some workers also identified additional benefits of use that were unrelated to their injuries. So for some, this included enjoying the recreational effects or the general relaxation that cannabis would induce. And for others, it was other physical benefits, such as increasing appetite. So Catherine here speaks to how cannabis helped her return to work. So yes, cannabis helped me return to work because the sleep issue was just crippling. I was waking up like every 2 hours. Eva spoke to how it kept her going and being able to do the things that she needed to do. It handles the day-to-day stuff better than anything else. Again, I've still got to get to work to run a business, take care of a kid, and focus on that. And I don't think I would be able to. Certainly, chiropractic isn't going to get me the extra 3 hours at the end of the day that I need to finish functioning, whereas the cannabis will. The second theme under impact that we identified speaks to the idea that cannabis was usually framed as a coping tool, one part of a broader toolbox, rather than as a cure for the injury itself. So although workers found cannabis to be helpful, they were often very clear about its limits. They didn't describe it as fixing the underlying condition. Instead, they described it as helping them manage symptoms and get through the day. So essentially making things more tolerable even as the injury itself remained. For many, though not all, cannabis worked as part of a multi-pronged approach. So alongside other medications, physical therapies, and self-management strategies, rather than as a standalone solution. And a few workers also pointed out another limit, that even when cannabis helped with pain, with sleep, or stress, it ultimately couldn't address the systemic and workplace challenges that they were dealing with and that were contributing to their symptoms. So Bianca spoke a little bit to this last issue. So it helped me to return to work because while I'm using the ointment, I felt better. I wasn't feeling the pain, so I was ready. But I didn't keep in mind that I'd be going back to work and doing the same duties and having my hand in the same position, basically for the whole shift. Eddie here also talks about how it was not a cure for the injury. I think that cannabis helps a great deal for superficial pain, mental pain, things like that. But when you've got two vertebrae in your spine crushing a nerve, there's no cannabis in the world that is going to dull that. This last theme identifies how, for some workers, cannabis came with unwanted effects, and finding the right fit wasn't always possible. So the most commonly described downsides were functional in nature. Some workers described feeling less motivated or finding it harder to function, follow through with what they needed to do. Others emphasized cognitive effects, brain fog, difficulty concentrating, and forgetfulness. A small number of workers also raised concerns that their use was becoming habitual and less focused on their injury needs. Another aspect of this theme was that using cannabis often required a lot of trial and error to find the right regimen. Different products, strains, doses, methods of consumption. This was true for most workers in the sample, including those who found benefit. But that process didn't always lead to a workable solution. So for some workers, they just couldn't find that right fit. And for others, the experimentation itself sometimes led to some really unpleasant experiences, often from inadvertently using really high doses. So Brittany here speaks to some of her negative experiences. I tried and I realized that it made me stupid more so than anything. I tried the edibles and I tried smoking, but it just numbed me so that I just didn't function. And that bothered me because I felt like I was now losing myself. And finally, we move on to the area of navigating cannabis use and work. Here we identified two key themes: boundary setting strategies and their impacts, and workplace accommodations for use and disclosure. So in this first theme, what we found is that returning to work often required workers to actively negotiate their cannabis use around workplace realities. So workplace substance use policies weren't always clear or even known. So workers relied on a mix of their understanding of the rules, the safety sensitive nature of their work, or simply a personal moral sense about not being impaired at work to shape when, how, and even whether they used cannabis when returning to work. To do this, most workers described boundary setting strategies. So the most common was scheduling use away from work. This typically meant use in the evenings or bedtime, so that they would keep a clear separation between their cannabis use and work hours. In this case, they often used other medications to get them through the day, or they would just go cold turkey. Another strategy was product substitution. So choosing products that they felt would result in little to no impairment and be safe to use before or at work. This included topicals such as creams and CBD dominant products. Finally, for other workers, the safest option that they could come up with was to discontinue use altogether. I will also note that there were certainly some exceptions to the first two strategies here, where a minority of workers described using cannabis before or near work in ways that were likely going to lead to residual impairment at work, including smoking an hour or two before. At the end of the day, though, these strategies had variable impacts on workers. So many felt the approach worked well for them and they had no concerns. But for others, it was challenging to put these limits on their cannabis use. So Tina, an early childhood educator, spoke to the challenges that she experienced by not using cannabis during the day. Because I couldn't use it at work, work was excruciatingly hard in the beginning. But again, it was the fear of getting in trouble, losing my job. And then on the other hand, my moral compass says we can't do that when we're taking care of children. I definitely had to juggle through what was more important to me, my moral compass or my pain. The second and last theme speaks to how formal workplace accommodations to use cannabis were largely absent. Rather, cannabis use was often something workers that largely managed privately without any formal workplace processes to support it. And a lot of that seemed to be related to hesitancies to disclose use to employers. So for some workers, disclosure simply seemed unnecessary because they were already keeping use separate from work, and their privacy felt paramount to them. But non-disclosure was also shaped by stigma and perceived risk. Workers worried that if an employer knew that they used cannabis, even if off hours, it could change how they were viewed, especially in safety-sensitive jobs. They also worried that disclosing would give employers the perception that they were always impaired. Several described a fear that if something went wrong at work, an incident, an error, an injury, their cannabis use could be blamed, regardless of whether they were impaired at the time. When disclosures did happen, it tended to be informal and relationship-based, so often shared with a close and trusted supervisor or in a workplace context where use was more normalized. So Eddie speaks here to the lack of need to disclose or to get formal accommodation. I never asked them about formal policies because I never did it before work. I never put myself into a situation where I would have to ask them if it was okay. And Nadia here speaks to concerns about what her employer would do with the information. I wouldn't want to just let them know willy-nilly, because if anything did go wrong, that would be the first thing that they would publicly blame. So let's, I guess, bring this all together. In terms of key takeaways, what we heard is that cannabis often was a pragmatic coping option for injured workers when other treatments fell short or they couldn't access them and they needed to find something to help. And this was often within this broader context of workplace and system challenges. Many workers did describe benefit, but experiences weren't uniform. People often had to experiment to find the right product, dose, and method that worked. And for some, cannabis simply didn't work. Even when it did, it was rarely a standalone solution. Most still relied on other therapies alongside of it. I think taken together, the findings reinforce a core message that we often see in the injured worker literature: the need to address return to work challenges that can undermine recovery. The findings also point to the need to ensure workers have access to a range of therapeutic and rehabilitative tools to assist in their recovery and cope with ongoing symptoms. Finally, our study cannot say that cannabis is an effective option for injured workers. What it does show is that workers are using cannabis and self-reporting benefit across a range of injuries and symptom profiles, some of which may not map to the conditions for which we have evidence for effectiveness of cannabis. But this is an area of ongoing research, and the findings of our study underscore the need for more research on conditions that are common among injured workers to identify which cannabis products work for whom and under what circumstances. We also heard that navigating cannabis use in relation to work was often private and self-directed. Workers were trying to balance two realities at once: managing persistent symptoms while also meeting workplace expectations around safety and impairment. As a result, workers described setting boundaries, usually in ways that sounded cautious, such as restricting use to evenings or bedtime, or choosing products they believed to be less impairing, though this wasn't always the case. Workers also weren't always sure of the existence of workplace policies, and concealment was common, in part because disclosure felt risky. In that context, formal workplace accommodations for medical cannabis use were essentially absent. Together, I think these findings point to the need for clear, well-communicated workplace substance use policies that explicitly address medically used products that may impair workers. Findings also suggest there's a need for safe disclosure channels at work that reduce the incentive to conceal use and hopefully support more proactive risk management rather than leaving workers to self-manage boundaries on their own. And finally, worker-focused education on cannabis use, particularly among workers in safety-sensitive jobs, may be helpful in generally supporting safer use practices among injured workers. So this concludes my presentation. But before I end, I do just want to extend a sincere thank you to the injured workers who participated in the study and shared their stories. This research could not have been possible without their contributions. So now I'm happy to field any questions that you may have.
Okay, thank you very much, Nancy. Excellent presentation. Lots of details that really give insights into the worker perspective in using cannabis and in recovering from an injury. We do have a few questions, so I will start us on those. If you would like to ask a question or leave a comment, please type it into the Q&A, and I'll do my best to get through as many as we can. So maybe just to start us off, you mentioned that sometimes workers were using cannabis as a substitute for other kinds of treatments. So they were making adjustments in other things that they were doing and preferring sometimes to use cannabis. Did anyone talk about this in terms of whether they did all of this on their own or in consultation with other health professionals? How did they talk about making these adjustments and what it might mean for other treatments they were using?
Yeah, so I think one of the things I anticipated also that there may be questions that would be associated or related to healthcare provider experiences. And that's another piece of this puzzle that I'm hoping to present on at a later date. Because we did ask a number of questions around workers' experiences with healthcare providers and talking about their cannabis use. I guess what I would say is that there it was a mix. I think sometimes when workers were able to work with their healthcare provider and get guidance on their cannabis use, some of that reduction or sort of modifications in their treatments were informed by their healthcare provider experiences. But I would say that in many cases, workers, and I'm sort of preempting some of those findings, but in many cases, workers weren't really talking to their healthcare provider or weren't getting guidance from their healthcare provider around their cannabis use. So a lot of this was sort of, to some degree, some self-directed. It was a bit of a mix, but there was some self-directed
Okay, and you
change.
thank you. You may not have heard this. It's related, and I know you can't give anybody treatment recommendations. So I'm going to change this question just a little bit to ask more about what you might have heard. Um, did anyone talk about having something like opioids? As the treatment for their pain, but wanting to not take that, but being concerned about what that might mean for their WSIB claim if it looks like they're refusing treatment. Any negotiations around that with WSIB.
So certainly we heard those, and I had mentioned this, we had certainly heard concerns around wanting to use cannabis in place of opioids because of concerns about addiction. We heard some concerns about with the WSIB, but it was mostly in relation to um, not wanting the WSIB to know about their cannabis use. For fear that that would affect their claim. Um, I don't I don't want to say for sure, but I don't recall that being a major theme where workers were concerned that if they were trying to change their that they if they were refusing one type of medication instead and then wanting cannabis, that was the concern as much as the cannabis itself.
Okay. Thank you. Did you hear from workers in terms of the type of cannabis they were using, THC versus CBD? Can you tell us a little bit more about that?
Yeah, so I don't have all of that information off the top of my head. I would say it was quite variable across workers. And I was also a bit short on time, so I apologize. I was
Oh,
debating whether to include some of this information, but so in terms of even methods of consumption, we it was a variety. So workers were using they were smoking, they were vaping, they were using oils and edibles. Topicals were also used. Um, Most workers were using some combination, so they weren't necessarily just using one. We did ask about THC, THC and CBD content. Um, and again, that was quite variable. And so some workers were using fairly high doses of THC. Others were using primarily CBD dominant products or lower doses of THC. And some workers didn't know what what the content was, which is sort of this knowledge gap if they don't necessarily know what they're taking.
right. Oh, thank you. That actually leads to the next question. Someone noted that you had indicated that workers were often trying to avoid using just before work, and wondering whether or not people were aware of how long cannabis takes to clear the system. Do we have good data about that? I know not in your study, but elsewhere. Is high concentration THC going to have cleared the system? How long would that take?
Yeah, so we didn't that was something we didn't ask workers about whether they knew or what sort of their knowledge was around, how long the effects take to kick in, depending on the method of consumption, and then how long those effects last. Um, in terms of good data, I think we're still learning. And we know that, for example, edibles, ingestible methods will last longer. Um, Clearly, higher THC products will have more of an effect. If someone is new to using cannabis, they will have a much lower tolerance, so they will also have probably longer effects. But we don't really have a good window. We don't know necessarily just how long. So there's recommendations out there to sort of say you should wait a certain amount of time after, I would say, and I'm going to probably forget the name of this, OMAC, which is the Occupational and Environmental Association of Canada. They've put out a statement that said that, that workers should wait in safety sensitive positions should wait at least 24 hours, if not longer, before engaging in any work after using cannabis. But those are sort of windows. We don't really have a clear, definitive idea. And again, it's variable depending on every person also experiences cannabis use differently. So it's a little bit tricky.
Right. So thank you. Next question. In terms of employers, you talked a lot about disclosure and how, this was not something that a lot of workers wanted to talk about. And so if we want workplaces to more effectively promote disclosure, did people talk about what they would want in terms of assurances, or how a workplace could help address this kind of persistent perception that someone using cannabis is going to be discriminated against, may lose their job, there may be incident investigations. Was there any discussion of what needs to be done from the employer's perspective?
Um, Not really. I mean, I think some workers did speak to um, employers need to be more open to this idea that workers are using cannabis and that, as long as they're using it safely, it shouldn't be an issue. Um, but I think they didn't really recommend anything as much as they just spoke about what their fears were. So the fear of if they found out that they would lose their job, that again, there would be this perception that they're constantly impaired. Um, and so I guess extrapolating from that, it would be ensuring that it's clearly communicated to workers that if you were to communicate this, there wouldn't be those consequences, because you're opening up that conversation and letting the employer know before something were to occur. But again, they didn't really say that, but it was sort of how they were positioning. It's really they were just talking about their fears of their employer knowing.
Okay. Did anyone talk about their experience around workplace accommodations, especially accommodations if they were in a safety sensitive role, and what that process looked like? And so that's sort of and then one other piece, um, was anyone able to use cannabis when they were working?
So we didn't hear anybody actually have formal accommodations. So I can't speak to, what that actually looked like, at least for this particular group of workers. It would have been certainly interesting to know how that was navigated, because I think that is an issue that employers grapple with. But again, I think it comes back to um, sort of workers were hesitant to disclose that they were using cannabis, and many of them just felt like there was a couple of workers that said it's none of their business. I'm not doing it before work. I'm not doing it anywhere near. I come home and I do that, and by the time I wake up the next morning, I'm good to go. So they don't need to know. And so there is this feeling, I think, that they don't. I think many of these workers didn't feel that they necessarily needed accommodations because they were using it in a way that they felt was sufficiently outside of work not to impact work.
Okay, thank you. Was there discussion about differences in the types of injuries? And a person here is asking specifically about use of cannabis to deal with stress and anxiety related to versus physical injuries. Are you hearing about that? And were you hearing about it being used more for one type of injury versus another?
Yeah, we didn't. So to keep in mind that everyone that we included in this sample had originally had some sort of physical injury. So we didn't include primarily psychological injuries. Um, Having said that, many of these workers experience some mental health impacts, um, anxiety. We heard about some PTSD. Um, we heard sort of generalized stress about dealing with the return to work process or workers' compensation and how cannabis was helpful for that. Um, but I would say that a lot of what we heard was so we did hear about workers using it for those sort of anxiety and stress related impacts, but everyone had a physical injury. So a lot of what we heard was around the pain of injuries, the disruptions in sleep because of the pain. And we didn't necessarily hear differences across the different types of injuries that people had.
Okay, thank you. Workers are often concerned about being put into drug monitoring programs, which can last for 2 years and be used against a worker if they admit to marijuana use in a WSIB claim. Did that issue come up at all? The sort of use versus abuse and what employers might ask?
No, actually, it didn't. I'd be interested in whoever shared that question, reaching out. I'd be interested in hearing more about that. We didn't hear that specific piece. Again, we heard from some workers about their own sort of concerns around what they were feeling like was habitual use, that was feeling maybe that they were losing some control of their use, but they never made that connection between concerns about what that would mean for the workplace. It was really more about they were just concerned about um, the addiction itself.
Okay, thank you. Um, in terms of workers who use cannabis, do you have a sense in your particular sample or from research that's out there with other samples, to what extent people had used cannabis previously for any other reason versus being cannabis naive? Did people talk about that?
Yeah, so um, I'm trying to remember. I believe about a third of the sample had initiated use specifically for the injury. The other two-thirds had some history of use, but that didn't necessarily mean it was recent. So some people would talk about, oh, yes, I've used it when I was a teenager or when I was in my 20s. Um, and so there was some history that way. And then there were some people who were already using it at the time of their injury. It could be because they were using it recreationally, but other times it was because they had another injury before this or another health condition that they were managing at the time. Um, so we unfortunately we didn't have specific enough questions to really disentangle um, the history of use, like how far back some of that was. But I would say I know for sure that there was about a third that were new to using cannabis for their at that after their injury.
Was it your sense that there may have been slightly different nuances in the themes that those two groups raised? So, those who were new, were they more worried? Were they more unsure? Were there issues different between the two groups?
Yeah, I think generally, and I think I sort of allude to that around the sort of hesitations and concerns around deciding to use cannabis. Um, Workers who had those previous experiences were less likely to talk about any sort of concerns because they already had used it. They knew what it was about. Um, and especially, I think if they were more regular sort of users, I think in general they were just less likely to report any of these concerns, even around sort of disclosing to employer. Um, I think it was just it's part of, for some of these workers, it's just part of their life. They're used to it. They don't really have those concerns. So I think those people it was new for them, certainly, I think we're reporting more of those
Okay.
hesitations and concerns.
Right. Just sort of picking up on that a little bit, did workers talk about whether they saw their cannabis use as being a kind of a long-term, issue that or a long-term thing in their life that they were, that they might not get past this pain, that they might have always some sort of challenges that would mean they'd be using this for a very long time, or did they see this as mostly short-term?
I guess um, I don't know if we specifically heard that. Um, but I guess what I would say is that the way that workers were framing this as sort of a coping tool, um, and in a context where these workers are also still experiencing symptoms 4 to 5 years later, I think what we heard was that it was just sort of, it was there to help them when they needed it. So one of the things that I don't think I mentioned is that, many workers, so some workers were very regimented in terms of their use. They would use it fairly regularly because that's what they found was helpful. But others also just spoke to intermittent use, so use as needed. So when something really just wasn't, when they were just having a really painful day, um, they and other things weren't working, they would use that. And so for me, I feel like, just in hearing these stories, it sounds like it's just a tool that they kind of pull out of their toolbox to use when they need it, and especially when other things just aren't working for them. So we didn't specifically ask whether they think that they're going to be using it long term, but it seems like it's just one of those things that they have in their back pocket to use.
Okay. Thank you. We have a couple more minutes for a few more questions. Thank you, everyone, for all the questions and lots of compliments, Nancy, about the presentation and how excellent it is and informative. A couple of questions about where people are getting their cannabis, and in particular, whether or not any of the workers in the study had an entitlement for cannabis coverage. We're getting it from licensed producers or others. Did you hear much about that?
Yeah, so again, I apologize for not including that information here because it's sort of connected to the healthcare piece as well. Um, but in the paper that I had mentioned at the beginning of the presentation, we had found there, I think it was about 20% of our sample had a medical authorization to use cannabis. And in this subset of that group, it was the same. So we had about 20% had a medical authorization. So some workers certainly were getting their cannabis um, from authorized producers, but many were growing cannabis. Many were getting cannabis from friends, family. Many were going to just dispensaries. Um, that was a very common source. So it was quite variable, but again, so that 20% was the probably the group that's more likely to get it from an authorized producer.
Okay. Thank you very much. Did any of your participants talk about significant outcomes in the workplace? That did any have accidents? Were there positive or negative impacts at work that they talked about?
No, we didn't. I am kind of kicking myself that we didn't ask more questions also around um, impairment or anything, in terms of how they're navigating that use. Again, because most were very clear that they set those boundaries, um, we didn't really get any information about anything that might have happened in the workplace. Um, and now I just lost the train of thought. Can you just repeat the question again? Sorry.
Whether they talked about any outcomes that had happened at work. So
Yeah, yeah,
accidents or positive outcomes, what kinds of things did you hear?
yeah. Yeah, so we didn't hear about we didn't hear about any accidents um, that at least that they were attributing at all to their cannabis use. And again, I think in relation when we were asking them about work and sort of the impacts of cannabis, it was the most common theme that we kept hearing. The most common story was it helps me to to sleep. It helps to take the pain away so that I can get a good night's rest, so that I can function the next day. Because if I can't sleep because of the pain, I'm a total wreck the next day and I can't work. That's what we heard a lot of. It was all very indirect through that sort of symptom management um, piece in the evening.
Okay. You mentioned right at the beginning of the presentation and also later on that a lot of participants turned to cannabis because they were not able to get support and accommodations in the workplace. That things hadn't changed with their job, those who were back at work and who were working in the same job. Can you talk a little bit about why that was? Is it the nature of the work that it was safety sensitive and there were fit for duty requirements? Was it that there was just nothing that the workplace had thought about yet in terms of policies and practices, the size of the organization? What's going on that people talked about that would possibly explain why they weren't getting supports and accommodations at work?
Yeah, so many actually did speak about getting accommodations.
Okay.
I think what we heard was that they weren't adequate. So
Hmm.
they felt like they were just not, they were still not enough. They weren't modified enough to be able to reduce sort of, for example, their pain when working. They were very short-lived. Um, there were some workers that just did not get any accommodations, and it was some of the things that we heard were it was just the employer basically said, I have nothing else for you. Like, take it or leave it. This is what you've got. Um, and so those are sort of the things that we were hearing.
Okay. Do you know of any court rulings around workplace cannabis policies? Some companies trying to impose um, new policies and practices, zero tolerance for recreation and health, medical. Have you heard about any of that?
Yeah, no, I don't, I wouldn't be able to answer that question. I mean, I think there was a lot around the time of cannabis legalization. I think there was a lot of um, there was a lot more in this space. In terms of medical use, I don't really have any information that I would be able to um, knowledgeably share here.
Okay. Just a couple of quick questions, and I apologize if we haven't got to your question. Please do follow up with Nancy. You had mentioned I'm just, sorry, finding it here. I'll come back to it. Sorry. So first of all, do you have any plans to follow up on the study or other kinds of methods or studies to look at cannabis use?
Um, what I was, in sort of doing this, I was thinking about the fact that I think it's one thing that would be really interesting. I don't have plans at the moment, but I think certainly never say never. But I think it would also be really interesting to hear the perspectives of other parties. So employers, how they're sort of how they what they feel are the challenges and sort of managing um, the process with injured workers who might be using cannabis medically, um, the perspective of workers' compensation in terms of to um, how to navigate something like cannabis that is very tricky to navigate in terms of treatment, the healthcare provider and trying to help the worker. So I feel like that was what kept coming to me was wanting that sort of information. I don't have those plans, but that might be something I might proceed with.
Okay. Well, thank you again, Nancy. I think that's all the time we have for questions. Really terrific, good information. Please reach out to Nancy if you have additional questions or if you want your question answered. Nancy's presentation and the recording will be available in about a week, so you can check there for other information. I hope you will join us again in about a month on April 14th. We will have our next speaker series. This time, Dr. Linda Robson will be speaking, and she'll be talking about initiation of OHS management in new businesses, implications for research and policies. We don't have the event page up right yet, but if you subscribe to IWH alerts, you will certainly get more information about that, and an events page will be coming up shortly. But today, thank you so very much, Nancy. Terrific presentation, and thank you to everyone who was here today and attended, and we hope you'll come back again in the future. Have a great day, everybody.